Hey everyone, welcome to Facebook Live with Advanced and Preferred Physical Therapy. My name is Regan Innes.
And I'm Karen Wilson.
And today we're going to talk a little bit about manual therapy. But first, we want to congratulate Donna Hett on answering our Facebook Live trivia question last Tuesday correctly. We will be sending a gift card your way. But this week, we are going to be talking about manual therapy. So we have a trivia question about manual therapy, which I will let Karen give you while I share this to our preferred page.
Awesome. It's more of a trivia question about low back pain, and here it is. Experts estimate that as much as what percentage of the population will experience a back pain problem in their lives? So fill that in below in the comment section. I'm going to read that again. Experts estimate that as much as what percentage of the population will experience low back pain at some point in their lives?
You would think that it would have to be kind of a big number.
Yes,
but,
it is.
But you never know. Yeah.
It is.
Alrighty. Rachel, did you happen to share it? You did share it to preferred? I'll do it right now.
No, I didn't, but I can. I shared it on your page.
Oh.
I'm going to tell you a little bit about manual therapy. So a lot of people ask the question, what is manual therapy? And really, manual comes from the Latin word that means hand. So simply put, it's a hands-on approach to physical therapy or occupational therapy, or it can be any other discipline as well. So therapists often use manual therapy in their treatments with patients, and we do that to help improve joint mobility or soft tissue texture, and basically the benefits of it is to increase range of motion, decrease pain, and also to decrease swelling. And honestly, it just feels good. So
for sure. We did a practice round and it's good to go.
Thumbs up.
Yes. So in what instances would you not use manual therapy to treat an ailment?
Sure. So if a patient has an acute inflammation, an acute infection, they're having a lot of night pain or a fever that would indicate an infection or maybe something else going on, if they have osteoporosis or if they have neurological or vascular compromise, those are all things that we look for when we do the evaluation, which is really important that you do see a therapist because we'll go through all those red flags and make sure there's nothing there that we would want to make sure that we don't do to harm you. So
is manual therapy something that's fairly common in the PT world?
It is very common. I want to add one thing. One other thing for a contraindication for manual therapy is bowel and bladder changes. So if you haven't had bowel and bladder changes in the past and you have terrible low back pain and you have some changes with your bowel and bladder, that is a contraindication. So we would call your physician and move forward. But manual therapy is used a lot. And honestly, I can say that advanced and preferred physical therapy, we do a great job with manual therapy. We implement that with most of our patients as appropriate, but we're really big on using our hands to help improve your joint mobility and basically your soft tissue texture. So it's a good thing.
Absolutely. What are maybe some general diagnoses that you see that you would treat with manual therapy?
Sure. So one diagnosis that we treat, if you're having a lot of pain with flexion or bending forward, that can indicate a lumbar disc dysfunction or maybe a herniated disc, something like that. A lot of those patients cannot sit. So sitting in that position, driving to and from work is an issue. If you have pain with extension, that can indicate more of a facet dysfunction, and facets are those little vertebrae that connect one vertebrae to the next all the way up your spine. They're little joints, that connect one vertebrae to the next. If you have pain with extension, that can indicate facet dysfunction, as well as stenosis. And stenosis is more of a narrowing of the vertebral column, whether it's in the middle or it's where the nerve exits on the side.
Right.
So
if I were a patient experiencing lower back pain and I went to my doctor and they referred me to you, what would that process look like?
So we would do a thorough evaluation and we would ask you all those questions that sometimes are uncomfortable, like have you had any bowel and bladder changes? How long have you had the pain? What's the severity of it? Highs and lows. Do you have pain all the time? Is it constant or is it intermittent? Does it come and go? And all of those questions give us a really good indication as a therapist as to what we need to do moving forward. So if you have pain that's constant, we may not be able to help you. We may refer you back to your physician. But if it comes and goes, that generally indicates it's more of a musculoskeletal issue that we can help you with.
Right, definitely. Well, we want to welcome some of our viewers today. Thanks for taking some time out of your Tuesday to join us. We are talking about manual therapy and the benefits it can have on specifically lower back pain. And so I think we're to the point where we're going to start showing you a little bit of the manual therapy. So, Rach, I'm going to give this to you, and that way if there are any questions, maybe you can pop in. So
you can lay on your back.
Okay, all right.
She is going to lay on her back. One thing that we can do with manual therapy, I would have assessed her lumbar spine, her low back. I would see how she moves. I would check her reflexes, check her strength, and all of those things to make sure that neurologically she's intact. I'm going to have you scoot to the right side of the table a little bit. I would also check her hip mobility and make sure that your hips are moving well. So I would just making sure that I'm looking at her to see that she's not having pain with that. Check hip mobility. If I see that there's a problem with that, I may do a little bit of traction of that leg. So I want to talk a little bit about traction or distraction. So you hear about traction or distraction a lot. And distraction of a joint, basically, if you think about pulling on a joint that hurts, if you jam your finger or your thumb and you pull on that joint, what it does is it stimulates mechanoreceptors in the joint. So I'm doing that to her hip, and Rachel's zooming in and you can see her hip there. And what does that feel like to you?
It just feels like a gentle tugging. It's not incredibly painful.
So if you had, if I were working on your lower back, I could use distraction this way. I could also give a little tug like that if I wanted, once I got her consent. I could also work on mobilizing her hip. I'm going to have you straighten this leg. So I could work on mobility of the hip if she's got some mobility issues and see what's going on here. There's lots of different techniques that you can use, and every therapist is a little bit different. You can do this in sideline, you can do this in multiple positions.
So if I were experiencing some pain, I'm sure you would read it on my face,
Right.
but too, what sort of communication happens between the therapist and the patient in these instances?
So what I would ask you if your pain feels better, or if it feels the same, or if it feels worse the whole time, and I would want you to tell me the whole time how you're feeling.
Right.
And in those situations, we want to make sure that I'm going to put this right here, that we're communicating, and she lets me know, because I don't want to do something that's more painful.
Sure.
So
is this maybe like the first appointment after the evaluation?
We do treatment on the first visit. I think that's really important, because we want to give the patient an understanding of what's to come, and also to see if we can change the symptoms.
Definitely.
So what I'm doing here is another form of traction or distraction. I'm using her hip to pull through her hip, but I'm also getting some distraction of her lumbar spine or her lower back.
It's feels very there's a lot of relief in this part of my lower back, which I would think that would be mostly your hip, but.
So this is a little bit more specific. I could also pull on your feet, and it would be more of a general traction. So again, remember, distraction or traction is to help stimulate mechanoreceptors in the joint, and that helps with pain relief.
How long do these treatments usually last?
We typically 45 minutes to an hour, it just depends.
Right.
I wouldn't do this for 45 minutes. We would do multiple different things in the treatment just based on what deficits you're having.
Right. Your initial reaction is to kind of tense up and not let that.
Yes, so I would just tell you to completely relax and tell me if you have any pain.
Gotcha. What are some common causes of lower back pain that you would treat with manual therapy?
So back to the lumbar disc dysfunction, someone that has a herniated disc, this is very helpful with. Someone that may have bent over in a position, in a flexed and rotated position, where they got a facet that's locked up. That's another. So it's varied, lots of varied diagnoses. Another way we could do this, I would use the belt, but this is just an example, is I could pull this way. Now if they have knee or ankle issues, I wouldn't do it like that. I would use the belt around. But these are all.
That feels great on the lower back.
It's good. It's a good one. I'm going to take this off so you can relax. One of the other things that's really important to remember with low back pain, and this is kind of, I think, one of the big things, is we want to make sure that we're educating our patients as to what we're doing the whole time, as Regan said, but also educating you as to what you need to do. So, you've heard of the term no pain, no gain. That's really a misnomer when it comes to low back pain, because we don't want you to go into pain with low back pain. So if you have pain, don't do it. I know that sounds simple, but that's one of the major things that we talk about with our patients. And we also encourage patients with low back pain to walk as much as they can. walk as much as they can and stay out of the pain when they're walking. That intermittent compression and decompression of the spine when you're walking helps increase blood flow to the area and really helps take away pain. Goes back to stimulating those mechanoreceptors in the joint. So
definitely.
Do you have any other questions?
I guess as far as like manual therapy for other parts of the body, not just lower back pain, we won't go completely into depth with that, but maybe what are some other stretches or treatments that you would use with manual therapy for maybe like upper back or...
Sure. So there are a lot of, you can flip over on your stomach if Rachel can pull the, flip on over. Put your face in that. There are lots of different manual therapy techniques that we could use. So say she's having some thoracic pain or some mid-back pain, shoulder blade pain, we can get in and assess the joint mobility here. So we do a lot of assessing joint mobility, motion, as we go up, and then I would assess the other side. So say she's having pain on the right, I would assess the left side first. Since she's really not having pain, I'm not really doing that. You can go in and with the patient's consent do a manipulation here, and that's just a mobilization, a grade 5 mobilization. We also do the same thing in the lower back. You can assess the pelvis, make sure that the pelvis is moving well, make sure the hips are moving well. You're a little limited there.
Oh no.
Same thing here. So this would be a typical treatment. We would have you move positions, change positions, and try to minimize how many times we have you do that, but you can sit on up. We would have you move positions just to assess. And again, we would check reflexes, we would check the strength and make sure that everything else is intact. But back to education, I would really educate my patient, and we all educate our patients on making sure that you're staying active as you can, because bed rest is terrible for low back pain. It's terrible for the spine. So that's really the point we wanted to get across, is manual therapy is a really big part of what we do as physical therapists and occupational therapists, especially at advanced and preferred, and it's something we pride ourselves on.
Right.
There is a certification that you can go through to get to do that, and some of us have done that, and that just helps along the way as well. It's nothing that you have to get, but it's just one of those things that you can do.
Manual therapy is so vast, and it can treat so many different things, and I think it's important for our patients to understand that it's, not just one treatment. I mean, there's hundreds and hundreds of different manual therapy pieces that go into helping you have less pain.
Absolutely. Many different techniques, and every technique is varied based on the therapist's experience and what they're comfortable with as well, and what you as a patient would benefit from and what you tolerate too.
Sure.
Because not everyone's the same. So
absolutely. Awesome.
That's it.
Any questions, Rach?
Nope, no questions.
Awesome. Well, thank you all for joining us today. If you do have any questions during the replay, be sure to place them in the box below in the comments, and be sure to answer our trivia question for a chance to win a gift card. We appreciate you taking some time out of your day, and we will see you next Tuesday.
Bye.